Hi, my name is Dr. Sarah Wright. I'm a GP based in the Midlands and I have a special interest in menopause and women's health. So, what is the menopause? The menopause is technically defined by when a woman's last period happens, and actually, what's more relevant really is the time surrounding the menopause, which is a much wider period of time, and that is known as the perimenopause. Around this time, which can be several years before a lady has a last period, women can experience a lot of different symptoms. So, what are the symptoms? People have often heard of common symptoms such as hot flushes and sweats, and these are often cited as being the most common, but in fact, these probably rank number 4 or 5 down the list. Women often present with a whole range of symptoms. This can be very different from woman to woman. And symptoms that we often see in clinic include things like anxiety, low mood, low energy, brain fog, muscle aches, just not having as much get up and go or motivation. People often, unfortunately, struggle a lot with many symptoms. It can impact on home life, work life. Lots of women end up giving up their careers early due to menopause. So treatment is really important and seeking the right advice is really important. So what can you do at home, or what can you do to help your menopause before you get to the stage of seeing a doctor? So lifestyle is really important, and we all know we should be eating healthily, exercising, not drinking too much alcohol, etc. But these things become particularly important around perimenopause. So doing exercise is a very important thing, but particularly exercise that's strength training to retain muscle mass, and also weight bearing, which helps protect our bones, which can get thinner and more fragile through menopause, would be really, really important. But also things that help with flexibility and are manageable, such as yoga and Pilates. Diet is also super important. This would be generally a healthy diet, but low in carbohydrates and processed foods, as many natural whole foods as possible, with plenty of fresh fruits, vegetables, fibre, and a nutritious balanced diet. But then we would start looking at whether HRT, hormone replacement therapy, would be a suitable treatment for you. Often women are scared or have heard myths and misinformation about HRT, and that's why it's really important to come and speak to somebody who knows about HRT and can assess your risk, because most women can very safely have HRT with very, very minimal and sometimes no risk. The benefits are numerous. The benefits often include not only helping women feel better with the symptoms that they're experiencing, such as anxiety, aches and pains, hot flushes, etc., but there are many other unseen benefits to HRT. If it started within 10 years of the last period, it can help reduce the risk of heart disease. It helps keep the bones strong and stops the onset of osteoporosis coming as quickly, which unfortunately is a big risk for women as they are perimenopausal and after menopause. It can also hopefully reduce the onset and timing of dementia. There is a reduced risk of diabetes, and in fact there's a reduced risk of death from all causes with hormone replacement therapy, which is often reassuring for women to know. And a lot of people come and see us thinking maybe the risks are much higher than they really are. So in conclusion, if you're suffering with what you think might be menopausal symptoms, or having a difficult time, or even if you want to plan ahead and know what to expect and what treatment options might be available to you in the future, I really urge you to come and speak to a GP such as myself with an interest in menopause, as there's so much we can do to help, and it really is so rewarding to be able to help women through this difficult journey and get them feeling like themselves again.